of mothers talking to their daughters about the gift and privilege of being a woman, of being able to be a life giver. You know, whether you have children or not, I think as godly women, we are made fearfully and wonderfully, and we have the opportunity to promote that.
Welcome, everyone, to Breaking Bread, the podcast brought to you by Apostolic Christian Counseling and Family Services. Wonderful, as always, to have you along. You know, a verse that we often cite in this podcast, because it comes up so frequently, is we are fearfully and wonderfully made. And I think today's topic is going to illustrate that in more beautiful ways. And with me to have this conversation is Kathy Knochel. Thanks for being here, Kathy.
Hi, Matt.
And Lynne Streitmatter. Lynne, thanks for being here.
It's a privilege.
We know Kathy already. Lynne, please introduce yourself, share a little bit about the work that you do, and then we're going to get into our topic.
So my name is Lynne Streitmatter from Sarasota, Florida. I'm married to Jeff. We have 4 sons, ranging in age from 29 down to 21. One of our sons is married, Gabe, to Haley from Detroit. And they gave us our first grandchild about 2 weeks ago. So we're delighted to have that gift of extended family. I was a NICU nurse in my early singlehood and worked in the OB first, OB women's health, and then moved to neonatal ICU. And then after I met my husband, Jeff, was a stay-at-home mom. And then as my children were getting older, had the privilege to go back to school. And what I thought was just to complete my bachelor's, actually, he led me into my master's, family nurse practitioner. And then he gave me the gift of working in a women's health and being able to work and get a fellowship into an area that used to terrify me, and that was balancing women's hormones, and gave me great instruction fellowship. And that is how I currently practice in women's health, GYN, with a specialty in hormone balancing for women.
Thanks for that, Lynne. And I think our listeners will see how apt she is to be here for our conversation,
yes,
Kathy.
yes.
And this is a conversation you've actually raised, and that's really about our bodies and knowing our bodies, because it impacts our well-being, our mental well-being and health in so many ways, right?
Yeah, I see it so often with a lot of the women I work with in the counseling world, is just the more that they can understand how their bodies were designed and how God created them and what's actually happening throughout their month cycle, how much that does impact their overall well-being, physical well-being, mental well-being. And so I'm so excited to have Lynne here to give us all the medical end of things.
Lynne, you mentioned hormones. That's a lot of the work that you do. Is that right?
That is.
I think hormones are incredibly mysterious. I'm capping out my biology education now, right? Maybe one class in college might be my cap, right? So, and then pretty poor student attention in junior high. So anyway, that's where I'm at right now. But I do know hormones are a big thing, right?
Correct.
Hormones are huge. But yet they're mysterious. Can you bring any clarity, Lynne, on what are hormones?
Yeah, so absolutely. So hormones are the chemicals God gave us. And I love the verse you started out with, we are fearfully and wonderfully made. I think anybody that's had the privilege of working in the medical community has been able to see that if they have their eyes open to it. So let's consider the thyroid. Our hormones affect every part of our body system. So the thyroid sort of being the master gland. If it's not balanced, it can affect our heart, it can affect our neuromuscular system, our GI system. If the thyroid isn't balanced, it can affect our whole health. Blood pressure, there's just a lot of symptoms that can come from an imbalanced thyroid gland, the master gland of the body.
Kathy, what kind of things do we see even in the counseling room that we might think it's a matter over here, but turns to find out it's a thyroid matter?
Yeah, I think, Matt, a lot of times what feels like just anxiety or depression or those sort of things, understanding that there can be medical reasons for it. And so as part of like an intake with somebody, we're talking about how is your physical health going? Tell me all the things that are going on with your mental health, because you want someone to be able to have knowledge of what's happening medically in their body, as well as the things that are increasing mental health symptoms.
And teasing out what is a spiritual matter,
yes,
what is an emotional matter, and
yes,
what is a biological matter is a task.
Right.
But it's important to sort those things out
Yes.
because they can be conflated.
Yes. And
right?
because it usually can be some of all of them,
Yes.
right? Because when there is something going on with the thyroid, it's going to manifest as various things. Yes, depression, you're going to feel these symptoms, and that's going to affect spiritual. And so part of all of this and part of the heart behind this podcast is you have to know all parts of yourself. You have to understand your body. You have to understand medically, spiritually, physically, all of those things.
I think knowing your body is a really, really important charge. And that's really what we're talking about. And I know the context and examples are female, but males have hormones too, right? And we see that. But I'm still fascinated, Lynne, with what these chemicals are doing. So the thyroid is the command center, and it dispatches hormones. And then what are they doing? Are they message senders?
Yeah, so hormones are message senders. That would be layman's term.
Yeah, well, that's what I am.
They direct.
I'm kind of impressed I actually pulled that out.
They direct the body on what to do. So the basic hormones of a female are estradiol, E2, and that is made by the ovaries primarily in your childbearing years. So when you're having cycles, that is your primary hormone. Estriol is the primary hormone of pregnancy, and it is made by the placenta largely. It's a weaker hormone. And then estrone is made primarily in postmenopause. How you manage it or how you metabolize it can be challenging. It's the one hormone that can cause problems in the postmenopause period because elevated estrogens can cause inflammation in the body and can lead to cancer.
What does it mean to metabolize it?
So it's how you metabolize or break it down. Depends on the genes you were given by both set of parents. So, cruciferous vegetables, that's like broccoli, cauliflower, dark leafy greens, bok choy, those things help us to do it, but a lot of times that's not enough. And especially for people that would maybe be taking hormone therapy, especially oral, they tend to have elevated estrogens without realizing it. So it's just something that you want to make sure your provider is looking at.
This is really interesting. Okay, now we've touched on some things which I can tell is going to become important, like diet.
Exactly.
Okay, so that's good. That's the big reveal. Maybe we'll come back to diet. I'm still really fascinated about what hormones are doing because they are giving some sort of marching orders to the body. Is that right?
Correct.
Okay, yeah, say more.
So each month they change. So you start out with, so a typical cycle is 28 days. For most people, it starts around the age 12, but 12 to 16 is the range. Start of your period is day 1. Most cycles are typically 5 to 7 days. After that, from day 1 to 14, the prominent hormone is FSH, follicle stimulating hormone. That's a brain hormone that talks to the ovaries and tells it, it's time to mature an egg, okay? Around day 14 is when you ovulate. So that FSH has told the LH, luteinizing hormone, to raise. And when it raises, you have ovulation where one of those cells has matured. Our Creator designed us for conception. When we ovulate, that's the ideal time for conception. The luteinizing hormone matures and causes the egg to expel. Ovulation or fertilization of the ovulation usually happens within 36 hours. You'll have a basal body temperature rise, and that's how people can know they're primed for fertilization, okay? So estrogen goes down a little bit. You have the LH surge. So incidentally, that is what the home pregnancy tests are checking, is it for LH surge. So for people having challenges with conception, sometimes they're not ovulating. So that would be a lab test you would want to look at. Day 15 to 28 is called the luteal phase. So that's when you have a decrease of the LH, FSH, and a rise of the progesterone. And so progesterone rises. That's what would maintain a pregnancy if there's a fertilized egg. And estrogen rises some, but then decreases when there's no fertilization. That's when you go have your menses, which you're back at day 1. Okay, so for people that have problems with conception, it can be they don't ovulate, no rise of the LH, or it can be low progesterone where they can't maintain the pregnancy. So those are things that your OB would want to check if you're having problems with fertility.
So it sounds to me that hormones are very much centered upon reproduction. Is that true?
I would say our master creator made it that way.
Yes. So, and I know we're talking, your explanation there is female, but males would be as well, right? Testosterone is the male hormone. Prominent hormone, right?
Yes, but women do create it as well.
Okay. And so the first is just as a kind of high level. Is that true across the board? Every hormone in the human body is attentive to conception and reproduction and the life stage of a person?
I believe so. That's my understanding. The gift of life.
That's really interesting. See, I didn't know that until now. I didn't know that
some hormones, like the ones made by the adrenal gland, are more about managing stress. So that would be like your serotonin, your dopamine. Those rise and fall. That's sort of our fight or flight. You know, the adrenal glands are set on top of our kidneys, nut size. They're responsible for fight, flight, managing stress, decreasing stress, getting us excited when we need to be excited. So yeah, the way we are created, we are fearfully and wonderfully.
Right. And so the hormones are very much attuned to life, giving of life, and the preserving of life, it sounds like. Kathy?
I'm learning right alongside of you, Matt. This is so wonderful. I would wonder, Lynne, so you talked a lot about estrogen at the beginning of this. Help a female understand what they might be experiencing if estrogen levels are not going the way they should be going in their life.
Yeah, so that's a really good question. It manifests different ways. So estrogen is responsible for our heart, our skin, the rebuilding of our bones. So people who go through early menopause or primary ovarian insufficiency, the way it would characterize in their life is the inability to get pregnant. And typically what we see, so menopause is, by definition, is one complete year without a cycle. Time leading up to that is perimenopause. We used to think it was a shorter time, but now evidence-based research says it's like 7 to 10 years. It can be 7 to 10 years before our actual cessation of our cycle. Common symptoms that people would feel, if that's your question, are hot flashes, night sweats, vaginal dryness, pain with intimacy, decreased libido, interrupted sleep. Go to sleep fine, wake up at 2 a.m. and can't get back to sleep. For some people, it's fatigue, brain fog, anxiety, depression. You know, there's a new book out that sheds a light on this. Highly recommend reading it, called The New Menopause by Dr. Mary Claire Haver. And it actually talks about things that I have learned from the book. Frozen shoulder, things that we usually thought it was just getting older that actually are related to lower estrogen.
So I think you called it like the childbearing years. Yes. So I think what I see is some of that, the rise and fall of some anxiety and depression is linked to some of that. And that's
absolutely
what you're saying.
Can be.
Yes.
Absolutely.
Yeah. One thing that I have noticed within this is I feel like there can be two ditches, and that is we either ignore the hormone cycle piece of it and just think there's a few days every month that are kind of bad and I'm going to be irritable and moody and kind of get out of my way, right? And then the other ditch, I think, is everything kind of gets blamed on hormones. I think what I can see there is individuals who have an existing anxiety or depression diagnosis, they can experience the PMS symptoms on more extremes. And then individuals who do not have that as like a co-occurring, there's still the shifts in moods, which is the estrogen pieces, but that is just the natural rise and fall of the body. It's something to be stewarded more than something to be concerned about.
Yeah, correct. So average PMS affects like 26 to 31, 1 out of 3.
Yes.
You know, whereas PMDD, much smaller, 3 to 8%, much smaller.
What is PMDD?
Premenstrual dysphoric disorder.
PMS, premenstrual syndrome, is a common thing that we may feel the last week before our cycle, where there's extreme depression, mood instability, there may be hunger, cravings, tired, bloating, joint pain. Those are common symptoms that, you know, you may not necessarily feel every month.
Lynne, can I ask you something about that? So, like, if they are experienced to more extreme, that is likely an indicator that something isn't balanced out right, or that you maybe are not taking care of your body in the way that it needs to be taken care of. Would that be correct?
That would be accurate.
Okay.
And back to the metabolizing thing that you had mentioned probably.
Yeah.
Right? How
well,
is your body?
Sleep. I mean, so one of the most important things is during that time, if you're having challenges, we recommend keep a diary of your emotion, throughout your cycle of what you're feeling, your emotions, cravings, nutritional, because that all plays into it.
And you would probably find those type of diary rhythms helpful too, Kathy.
Yes, absolutely. Because again, that goes back to our earlier conversation of like teasing out what is medical and what is more emotional health based. And so if any female client of mine has likely heard me say lots of times, are you tracking all month long? Because you start to learn, and again, learning your body, learn and understand during this phase. Lynne talked through all the phases. During this phase, this is typically what I experience with sleep, with eating, my social battery, all of those things. Tracking is important for sure.
Absolutely. So premenstrual dysphoric disorder is like PMS in a more extreme. And you would want to just do everything you can to manage that with good nutrition, make sure you're getting your rest during that time. And then there are some medical things we can do as well that you should see your provider for. And that's like usually doing a low dose progesterone during that time, that week before, or the second part of that cycle.
I think it's good to think about the PMDD. You said it, but it's the severe or extreme. And I would say that from a mental health perspective, when that is diagnosed, we really are seeing that in big extremes, like participating in work, participating in things at home is almost impossible during that certain cycle, that certain phase of the cycle. And I would say that there's definitely an increase in depression. If somebody already has anxiety, it can be an increase in intrusive thinking. For the individual diagnosed with this, I see more suicidal ideation during that time. This is the extreme with the PMDD.
Yeah, and what I'd want to add with that is what we're seeing with postpartum depression. It is a real thing. We used to call it the baby blues, but it is a real thing. And people that have anxiety and depression prior to pregnancy tend to have higher risk of postpartum depression and also with perimenopause, menopause symptoms. So definitely highly recommend getting medication and getting that managed if at all that affects any of our population.
Let's linger a little bit more with that postpartum. What's happening in the body hormonally, and how might that manifest itself?
So after you deliver, I mean, the way God made us is so amazing. The hormone that we use to induce pitocin, oxytocin, when you deliver, that same hormone is what causes the uterus to shrink to keep women from hemorrhaging. That same hormone is released when a mom's looking at her baby. That oxytocin also is what causes, for those choose to breastfeed, it causes the milk to let down. And when that happens, it also continues to shrink the uterus. So the way God made us is just so amazing and fascinating. So when you're postpartum, you have these shifting of hormones, your estrogen, progesterone, oxytocin, other hormones that affect that. Your body's changing. It's going through a reshifting of nurturing a pregnancy to trying to return back to normal. We know that takes up to 6 weeks, maybe even longer. So with those hormone shifts, women that are overjoyed having, the gift of life, also sometimes they feel thoughts that scare them, like with thoughts of harming the child. And fatigue plays into this, trying to take care of yourself. If you have other children, your family, the fatigue of a newborn, having to feed a newborn, all that can really play into giving you feelings of hopelessness, of guilt.
Absolutely. Yeah. Intrusive thoughts of like, am I going to harm my baby, or to all kinds of things. The amount of guilt that comes with moms then, which what I've experienced with others is it kind of drives them to secrecy about it versus just like that ability to say, God designed my body beautifully and this is the hormones doing its thing. I can get help and support around this and talk about it. These are experiences that happen.
It's become such a common issue that we now screen our mothers at 1 to 2 weeks. We have them come back into our OBGY comes in to see if they need help to offer that. It's become a routine check.
Speak to that listener who is dealing with it, whether in herself or in her family.
Rest, first and foremost. I tell all new moms, you need to sleep when the baby's sleeping. Rest and nutrition is important, especially for someone breastfeeding. I think it's important for moms just to even have mother groups, other women. It's wonderful to have that support at home, but I think women need women. They need to talk. And probably after they realize that a lot more people experience this than they thought before and are able to talk about, they'll find out that they have a lot of friends out there that have also experienced that it's more common than we believe.
Is there a certain length that you can hang on? It's going to be this long. I'm sure there's not a hard fast there, but what do you see in terms of the duration of postpartum? Is this a 2-year deal or is this a 1-month deal?
For some people, it's up to a year. So medically, what we would do in our practice is primarily if there's no allergies, or we would do a low-dose SSRI. Zoloft is a common one. Low-dose Zoloft, and that would be managed for a year or as long as the patient needed it.
Yeah, I would say those things that Lynne are talking about are certainly the things that I find myself talking with new moms about, of how are you taking care of your health, sleep, what kind of support do you have? I think sometimes it can be even what kind of boundaries are you setting with what the expectations are on you, or sometimes who's all coming over, or, that sort of thing. But then also knowing some of the skills and tools like healthy thinking styles, or what are some more helpful ways of thinking about yourself, your body, that sort of thing. Also, I will do some of the behavioral activation work with somebody that is having some postpartum, which is what we do for depression. And that is while you need rest, what is the schedule that you're following also? How are you getting up and getting moving and done with support and that sort of thing? When it is moderate to severe, I do recommend the use of medications, like you said, the SSRI. I think that's it can be helpful and important to just kind of help an individual get to the point where they can see up and over the fog of postpartum.
This is really enlightening. And I'm still really struck by this power of hormones. I'm still stuck on this hormone thing. So they give marching orders to the body. Am I right? And even as I hear you explain that, again, we've been very concentrated on the female body because in some ways, dare I say it, you're more wonderfully made and complex because of your body in a month's time goes through this cycle where the male doesn't, although that's another question. And I want somebody to answer what cycles does a male...
Andropause.
Yeah?
Yeah. But I can't speak to that issue, but it is a real.
I was going to say, Lynne, take that one away.
Yeah. I mean, because we have to be very in tune to our bodies as well. And we have hormones as well.
Right.
And they are giving us marching orders, right? And so parsing this out between what's my hormones telling me I should be doing right now, and yet we try to have a connection with God, and we want God to be telling us what to do. You know what I mean? I can see how these can become conflated sometimes when we get unhealthy. Is that a fair observation?
I would agree. So I think that's why it's important to be in the Word and knowing the Word. And if what your hormones are telling you to do doesn't line up with the Word, then you need to think about it.
Someone made the statement once, the Bible does not say have the fruit of the Spirit when hormones are in balance or during a certain phase of your monthly cycle. And I think that's true. While hormones do a lot of changes in us, we have to continue to be stewarding them in a way that allows us to be living in the Word or being godly. Yeah.
Lynne, what questions maybe should a young person be asking their mother? Or maybe what information should a mother be thinking they should be passing along to their daughter?
So important factors is, when did she start her cycle? What were her cycles like? When did she go into perimenopause, menopause? Because that can be an important factor. How about bone density? People that have osteoporosis, it can be genetically driven. There's a lot we don't know about, But there is some evidence pointing to some of these challenges can be also genetically related. So I think just a mom being really transparent with how it was for her and relating that to her daughters.
I think that's really important. And I'll say dads to sons as well. But I know that I'm finding I've got more questions as I'm growing older to older men. Like, is this what you experience? Like, help me understand life in stages of life, because there's no way of knowing it unless it's the rearview mirror, right? And so anyway, I think that's really important. And I think it's a larger concept that we can take as sons and daughters and mothers and fathers, right?
And I think there is so good for moms to talk with their girls. Really how we started out talking today of like the beauty in how God designed your body. If it's not talked about that way, it can become such a negative in a female's life. I know it's really easy in the hard, stressful years of teenagers to be able to see, like teenage girls, be able to see like when they're in that PMS stage or when PMS symptoms would be likely. And it's easy to be able to kind of shoot that at them of like, you're hormonal right now. And really, if based on all the things you said, we're hormonal all month long. And so being able to give better language to it and better tools and resources to navigate those days versus like, stop, this is just hormones. Yeah. I think that it's just a wonderful conversation to be having with teens.
Well, and just of mothers talking to their daughters about the gift and privilege of being a woman, of being able to be a life giver, whether you have children or not. I think, as godly women, we are made fearfully and wonderfully, and we have the opportunity to mentor other young women, whether they're our daughters or not. We have the privilege and opportunity to compliment men. And it's a beautiful gift we've been given. And I think to promote that rather than put it in a negative light.
Absolutely.
Indeed, we are fearfully and wonderfully made. Yeah, Lynne and Kathy, as we talk about that, it just became more and more evident. And to even kind of take a couple steps back, I don't think we can help or get out from underneath as humans to divide things up into categories. The human body, from the emotion, from the spiritual walk, from worship. We have all these compartments that we think of things in. And I dare say Jesus sees them much more integrated. Would you agree with that?
I would agree.
And that our bodies are not only fearfully and wonderfully made, but our worship is done in our body. We worship God via our body. It houses us and is going to be resurrected, right? I mean, blows our minds. We can't quite get our minds all the way around that. But I think what you've done is elevated the body to a sense that, no, it's not just biology and physical things. These are very instrumental in how we live our life and how we worship God. And our hormones are very much a part of the picture of loving God and loving others and living well with ourselves. Is that fair to say? And so knowing ourselves, whether we're female or male, knowing our bodies and the intricacies is a really high calling and is very motivating. I think it's something that we all should step into. Thank you, Lynne, for your expertise. Lynne, you shared a lot of $100 words. So for our listeners, we do have on our show notes, we're going to have a couple links there that's going to have some graphs, some of the terms that we use, some of the acronyms, so that we can use those as reference. Thank you for bringing clarity to that. Kathy, as always, thanks for elevating this topic and allowing this to be heard by our audience. It's so important. So, and to each one that has listened, I hope you, as I have been educated. I think you probably have been educated, but also inspired by what God has done in all of us. Thanks each one for listening.